So the first question was if I'm about to attend a meeting for the organization's healthcare ethics committee in which an ethical conflict that the organization is facing will be discussed, how would I prepare for that? So I feel like ethics is kind of an interesting subject, especially whenever something is going to be reviewed. I believe that you can be unethical, but you can have the best interest at heart. For an example like this is patient autonomy, if I can say that right. So basically, when a patient has the right to decide what happens with them with their treatment, so like if they have a DNR and it's do not resuscitate because they've been on the transplant list for 3 years for a heart, right? And they're in the hospital and something happens and they pass away, or not pass away, but they are, well, and a nurse goes ahead and she starts performing CPR to bring them back to life because they just got news that like the person got matched with the heart. So that's something that's unethical, but at the same time, the nurse is trying to do good by saving the patient because they did get the heart. So it's not like she's just resuscitating them just for, the heck of it. So basically, I think I would just have what my ethical values are, obviously the ethical principles, and I would just use those as kind of like a guide to what happened. I think also just going into it with an open mind, to just hear what the person had to say. Obviously, you can be unethical and break the law, and it's for the wrong reasons. So, but yeah, I think ethics can be kind of a interesting subject. The next question is how beneficence can have a negative implication. So this one was kind of hard. I guess maybe like honesty and justice. I thought maybe could be negative. Obviously, you're supposed to present with the patient all the risk and the benefits and everything that could happen during the surgery. And I don't know. Could you be too honest with someone? That could be negative. You could maybe scare someone out of doing something because you told them all the facts, all the deaths that have happened. Or like maybe you're focusing too much on the negative side of it versus like the positive. And then also with that, you're not supposed to give your opinion with honesty and justice. But I feel like probably a lot of clinicians do. I know that I get asked my opinion on procedures every day from patients. If they should do it, if they should do it a different way, should they wait? So I feel like having an opinion could be negative too, obviously, because you're basically trying to help somebody decide on a decision to make, and that could come with backlash if something were to happen. However, I feel like I don't know how people in healthcare would work without giving their opinion, because we obviously know not always the right answer, but we do have a lot of background knowledge on certain subjects. So basically what I'm saying is if I were in the position to have something done, I would ask my doctor for his opinion because I just don't know. But I think that could have a negative implication. So the next question gave the 3 situations involving decisions and which one of these involve an ethical conflict. But it said pretend you're a patient safety officer. So right off the bat, the first one I didn't see anything negative or that was ethical or unethical with that. The second one, however, is one of those that's a little, could go either way. So basically, to somebody who is about to buy the software package and they want to buy the best one, however, it's out of the budget. The issue is that the person decides to buy it and to break it up into 3 different payments along, so it doesn't look like they spent all of that budget money in at once. That's very unethical, just because that money is there for a reason and you're on a budget for a reason, because you never know what could happen. And I mean, I feel like if you're willing to do that with money, that's a little scary, because it's not like, I don't know, that's a hard one, because you are doing it for the greater good necessary. I mean, you're getting the best software package. Does that really benefit the patients? I don't know. I guess it just depends on how the other ones are. But I do think that if you're trying to conceal the cost, I think that would be definitely an ethical issue, especially because money is something that you should not mess around with, because you never know when you're going to need it. The third one was, I don't know why, it kind of made me go back and forth. I didn't really think that it was unethical necessarily. I mean, it does say that the vendor would pay for your flight, as well as your a 2-day stay in a hotel. So that could be considered like bribery almost. Kind of like if you are, on the market to buy something and someone starts giving you a ton of free gifts and, trying to get you to buy their product, then that could be bad. However, I do think that he is trying to do the right thing, because he does want to see how the software works, and it is set up there in Florida, so it's kind of an iffy one. Again, I feel like everything in ethics it's all just kind of a iffy subject. But yes, I would say that would be have an ethical conflict, because it sounds like bribery. And so if you can kind of rationalize going on a vacation and having someone pay for your flight, who knows what else you would do, especially like if a patient tried to offer you money or anything like that, if you would take it to try to, help them get ahead or help them with something. So I think both of those would be have ethical conflicts. The first one was just said you need to choose among several software packages to track events involving patient safety, and that you might need some assistance. So that one, there was no issue with that I saw. The last question, clinicians' ethical obligations typically focus on promoting the best interest of their individual, whereas like a healthcare manager focuses on like the whole population. How could these different perspectives affect discussions of ethical conflicts? So, it's basically just, if you are starting to look out for just one patient or a few patients that are yours as a clinician, and you're doing things that are off the books, that are not, not unethical, but let's say you're giving someone special treatment, or you are doing something pro bono, it's not really, well, pro bono would be up to the provider, I guess, if you could get people to do it with you. But, I don't know, it's just, you definitely need the balance between the two, because I think that the healthcare managers they help to keep the balance amongst everybody, whereas clinicians can easily, or nurses, or whoever it is, dentists, I work at a dental office, So you do become attached to certain patients, and you hear their story, or they don't have enough money to do treatment that they need, and you want to help them. And we can do that a little bit easier at a dental office because we're a private practice, so whatever our dentist says goes. I mean, it's literally his business. So it's different than